Hello, today is November 14th, 2020. My name is Daniel Porras. I am interviewing Ana Alonzo for the University Library Special Collections and Archives at the University of Texas Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Mrs. Alonso, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, I want to honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and other documentation you are willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you donate to special collections at archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures. Before we continue, so I'll ask you a series of 6 questions. Please say yes, I agree, or no, I do not agree after each question. Do you give University Library Special Collections and Archives at University consent to archive your interview and your materials at the UTRGV University Library?
Yes, I agree.
Do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with Voces Oral History Center at the University of Texas at Austin for inclusion in the Voices of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
Okay, as you recall, we previously filled out a pre-interview form. We use information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it UTRGV University Library Special Collections and Archives, we would have stripped all and any contact information from yourself or family members. So that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. So do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
Yes, I agree.
On occasion, UTRGV Special Collections and Archives and Voces receives requests from journalists who wish to contact our interview subject. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes, I agree.
Okay, thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in the interview questions that I will ask right now. Okay, so the project question was, what are the stories and experiences of Latino and Latina in South Texas during the COVID-19 pandemic? And the goal is for viewers to gain a greater appreciation of the experiences of the Latino community during this historic time. So, Ana Alonso, thank you for your time. I'd like to tell you again that your stories and experiences are very valuable to UTRGV Special Collections and Archives and the Voces project for us at UTRGV and UTRGV Special Collections. We are committed to preserving the stories of Mexican American and Latinos from South Texas and the Rio Grande Valley, and those who work closely with these populations during this COVID-19 pandemic. Because you work at the hospital as an essential worker to our community, and because you are a mother who contracted COVID and cared for your children who are also ill, I know you have many meaningful stories and unique experiences to share with us about COVID-19 and how it has impacted your life. So before I ask you to share these stories of your life during this pandemic, start with the first question. Tell us about yourself. Who is Ana Alonzo?
Gosh, okay. I am a mother. Like you said, I'm a mother of 5 sons, 4 of which still live with me. So that's very typical Hispanic household, I think. And I work at the hospital. I've been working in a hospital environment over about 24 years now in several hospitals here in the Valley. And I like to read. I like DIY stuff around the house, but I think just normal Hispanic mom, cooks for the family, and works a full-time job. So I think that's a little more normal, considered normal nowadays.
That's great. Okay, so I'm going to move on to some questions about your first encounter with COVID-19.
Okay.
So the first question is, when did you first hear about COVID-19 and how did you learn about it?
So I listen every morning to a podcast, Up First. Kind of keeps me up to date on the world, what's going on in the world, what's going local news. And so I actually heard about it when it first came up, when it was in China, in Wuhan. And it was last year. So it was like December last year, I think, when we first started hearing about it. And then once it started on the news, you would hear, okay, because I don't listen to local news as much. I don't watch the news on TV when, at 10 or at 5 or 10 when it comes out. I really just stay up to date with social media and the podcasts I listen to. So when you start hearing about it, when it was coming over, right, per se, to the United States, then the hospital that I work at started a task force. They started communication. They started making preparations. So by the time, I want to say March was probably when we were doing lockdowns. And I may have my dates a little off, but I had already been hearing about it for some time and how it was going to Italy, and then it made it here, and then it was in New York. So in March, when it was very heavy in New York, we were making preparations here. We didn't have that many cases down here that I knew of in my hospital, but our hospital, and I work in the IT department. IT department starts doing what they can, ordering more computers. They were setting up certain areas in the hospital to be prepared for when it hit down here. And what I noticed, we're about 2-3 months behind the New York timeline. So when New York got hit very heavy, we weren't there yet, but about 2-3 months later, it's when we were hit pretty heavy. So I'm sorry, to answer your question is, I heard about it last year in December, but just listening to the news, to world news, right, and to see what's going on.
Mm-hmm. Wow. So you
Mm-hmm.
guys were preparing for it before it even hit the valley?
Yes, and I think you have to. I mean, once the United States, I mean, we have hospitals down here. Normally, hospitals aren't set up for critical care patients. I mean, they're set up for a small amount of critical care patients, but not the large volume. So they move some, you have to have a unit ready to be able to give them the needs that they want with oxygen and ventilators and everything. You have to get extra nurses to take care of the patients that you're expecting to come in. We do a lot of, our department has to order computers. So say you have an area that would normally be a gym, and say, okay, we're gonna make little beds available. So then you have to bring all the computer work. I mean, they still need to print, they need to document the computer system. They need to be able to print, they need extra network. You get the facility people of the hospital to come and set up borders, and say, no, you can't come in this far. Everybody has to get their temperature before they come in. So there's a lot that goes into, I'm really downplaying it. There's just a lot that goes into preparing a hospital for the expected high volume of patients that you think are going to come in and that are very sick. So you need to make sure you have your PPE, because you can't just take care of the patient like this, right? Like, oh, hey, come on in, let me put a Band-Aid on you. You need a lot of equipment to be protected to be able to take care of patients with a virus that's this contagious. Yeah.
Right. Okay. So when you first got the information and you started understanding COVID more, what was your first reaction to the information that you received?
So you hope that, I mean, when I first heard about it, it wasn't here in the United States yet, right? It was in China. And so you hope it's going to be maybe like SARS, to where, yes, it was bad, but it was bad somewhere across the world, right? Nothing that's going to be close to home. And I think as we started realizing that it was coming closer, at least my coworkers, and I'm in a non-clinical area, so I'm not near patients, I'm not taking care of patients, we're in an entirely different building. But even the environment there, I think there's a lot of fear. There's a lot of fear, a lot of anxiety. And if you're clinical, you learn to take care of patients that almost everybody's contagious, right? I shouldn't say almost everybody, but a large majority of the patients have some kind of infectious disease, and you're prepared to be able to take care of them. You already know how to wear your gloves, how to gown up, how to wash your hands. But I think non-clinical people don't know like, hey, if I wash my hands, I'm really decreasing my risk. And so the anxiety was a lot larger there. Everybody wanted to go work from home right away, to say, hey, let's go work from home, forget it's not safe here. But if that was the case, it wouldn't be safe anytime, right? Because you have a lot of infectious diseases that spread respiratory. TB is big down here in the valley, and we're still able to take care of that. So you just have to make sure you have the precautions in place. But there was a lot of fear in our departments, and people that maybe have a high risk of contracting it because they have other conditions. So they're saying, oh, if you're diabetic, you're more likely to die. So all the diabetics that I work with, you start getting nervous. We do have some people that are fighting cancer, and so they're at a high risk. So a lot of our coworkers had brand new babies that had just been born, and so they're worried about their baby getting it. And so I think that's the first reaction generally, is the fear of the unknown, right? The anxiety. If you don't know what's coming, you don't know how to take care. You don't know what you're going to have to do to take care of your family.
Wow. Okay. So at what point did you realize this pandemic was serious, but mostly when did you realize it was a life-altering event?
I think when we locked down, when Hidalgo County locked down and said, okay, all the non-essential workers had to stop working, and that actually affected. So we are 7 people living in the home, and 4 were in restaurants, bars type of jobs. And so half of the family wasn't working. They were sent home. You're not working, you're not getting paid, so you still have your bills to pay. I think that's what kind of made it serious, is once it's affecting the economy and your livelihood, really. And so the good thing is, because we're a family of 7 and the other 3 were still working, and it's enough to kind of keep the family going. So myself, my husband, and and my oldest son, who doesn't live here but was still able to kind of help us out, are the ones that kept working. And 2 were in healthcare, and 1 was essential service because he was delivering for the supermarkets. But all of the other 4 that work in food service, they were all laid off. So that's when I think it became real, once it actually affects you. And this was still back in, I guess, March, April, so it was still pretty early in the year.
Okay. Over the last few months, what news media, social media, or other sources do you rely on to keep you informed about the coronavirus?
Still the podcast, the news podcast, and Facebook, really, where the Hidalgo County is putting out information out. The local doctors put information out. I think I get information from there. There's also, I follow certain people that put out statistics. I enjoy the videos that will show me a graph and will be like, this is what the numbers are, this is where they're at. Even my weather app actually started posting, I don't know if you saw that, but my local weather app was posting COVID numbers for the county. So that was pretty interesting. The Hidalgo County numbers we were tracking. But mainly I would say news, podcasts, and Facebook.
Okay. Can you share with me what you understand about COVID-19 as an infectious disease? And also, could you share with me what you don't understand about COVID-19?
So I understand that it's a respiratory transmitted virus, that you can limit transmission by wearing masks, by both people wearing masks, because you wearing a mask won't prevent you from getting it, but it lowers the risk. And I think there's still a lot we don't know. I know there's vaccines that they're trying to make, and we don't know how effective those vaccines are. I'm not as afraid of it maybe as some of my family members, because I feel like there are steps that you can take to minimize risk. That we know of, right? Which is maintaining distance, making sure that you're hygienic. You go to H-E-B, you wipe your cart down, you use a hand sanitizer as much as you can. Although I do tell my family to, if there's a sink, wash your hands instead of using sanitizer, because that's always better. And they don't have to. I think what I don't know is, I can't confirm that, I know we don't know everything about it yet. And I don't know how long we're going to be immune. So later in the summer, we did get COVID, and actually 6 of us did. So my concern is, I don't know how long I'm going to be immune per se. So usually you get a disease and you're immune for some time, you can't catch it again. I don't think that's the case with COVID-19. And so I wish they would come out with more studies. I know it takes time to have the studies and have the research out there to know how long will you be immune, and is it going to last? Will I still be able to get it again later this year? What am I going to get it again next year? And I think that's what's the stuff.
Hmm.
So transmission, I understand. Immunity, I wish I knew more.
Okay. About the vaccine, would you take the first COVID-19 vaccine available on the market? Why or why not?
So, yes, I mean, I do work in healthcare. I do believe in science, and I do think that we have enough regulation in our country that they're going to do as much testing as they possibly can before they roll out a drug to the entire country. I think as a healthcare worker, we are usually one of the first ones that will get it, because you have to make sure your healthcare workforce is immune so that they can take care of everybody else. I don't like that they're rushing it. I think that's kind of scary that they're rushing to get the vaccine out. And I know they have to. So, but to me, that means that you're going to limit the amount of time that you have to study what the effects are going to be. But generally speaking, all the vaccines that we already have approved and are pushed on people to get, I think they're good. They do more good than harm. I think there's always going to be, in any medication, you're going to have people that don't respond well, but that's going to be the case everywhere. And I think I would get it. I mean, even if I wasn't a healthcare worker, I think I would still want to get it. But I do understand that the healthcare workers are going to get it first.
Okay. Do your family hold the same beliefs as you about COVID-19, or are there some members who take it more or less seriously?
I think there's a mix. I think there's a mix. My oldest son is a pharmacist, and he and I share a lot of the beliefs about science and chemistry and medications and how they work, and vaccines. And I think there's I would say some of the older family members in my house, or not my house, but in my family, that are a little more afraid maybe than they have to be, and they have not gotten together the entire year. I don't think they have to be that afraid. I mean, if you're limiting your exposure, if you're mainly at home, if you're taking the precautions, I think you shouldn't be as afraid. And I think it comes from uncertainty. So they don't know what they don't know. They just know it's out there. They know it can kill you. So their anxiety is a little higher than ours. And I think generally speaking, there's just so much information out there that it's getting harder and harder for just the general person to understand what's real and what's not real. I think social media has about information. And so you kind of have to gauge what you see, what you hear from a variety of sources before you make a decision. And I think if you start seeing a lot of information that you believe to be true and it may be misinformation, it's harder to convince them that it's misinformation, right? Because it's what's out there. But I mean, generally, I don't know that, at least the people in my household, I don't think they are super afraid of it. I think nobody doesn't believe in masks. We're all wearing masks. We're all trying to do what we can. But I mean, some days are better than others, I think. I think some days we've had only one person that we know, one of my husband's friends from high school died, and she was our age. So I think that kind of hits close to home, but otherwise we don't know anybody else. We know people that contracted COVID, but nobody besides that one girl that has died from it. Okay. I think it's just general anxiety, and it's frustrating, of course, to have to wear masks everywhere, and we'd prefer not to do it, but of course we do because we know it's important.
Right. Okay, so I aim to center these next set of questions around your current job and the impact the virus has had on the workplace. Okay, so could you give us a description of your current job?
So I work in information technology, and in the sub-department that I work in is clinical applications, which means we support the computer applications that are used by the clinical staff. So the electronic medical record is something we support. And if a doctor where the doctor's taking care of you as a patient, say, and they have to document what they saw. You came in with these symptoms, and this is the treatment plan I'm going to give you. That's all documented in a computer system. We support that computer system. Not just one, we have about 50 clinical applications that we maintain and we support because they're all used in a different setting at our hospital. So officially my department's clinical informatics, and my team takes care of applications that support the ancillary department. So say cath lab, radiology, cardiology, case management. There's a lot of applications that those departments use that my team takes care of.
Okay. So what type of precautions did your workplace take to avoid and prevent the spread of COVID-19, if they did?
So they did everything that was recommended by the CDC. Social distancing, so they separated all the desks, all the workers. They split them. Some got approval to work from home, and the ones that had a condition and had a doctor's letter to say their risk was higher and they had to work from home, those work from home, which freed up a couple of desks. So we did all the 6 feet distancing from all your coworkers. They were making everybody wear masks. They also, I'm sorry, someone walked into the room. They also, let me send it. The masks, the hygiene, anything that we had to touch, all the break rooms were cleaned more often, all the restrooms are cleaned more often. Masks were mandatory. We used to have a punch clock that you would go and touch with your finger, and that was taken out, and so now you have to swipe so that you're limiting like the spread of infection. And then where we used to have meetings, now they were all online meetings. They all became web meetings. And so I think those were the main precautions: the hand hygiene, the social distancing, or even in the workplace. And there couldn't be more than 7 people in a room, so we made that change as well.
Wow. Okay.
I'm sorry, one more thing. We also split shifts. So before there was so many people in the room from 8 to 5, and we split the shifts from a morning shift and an afternoon shift to limit the amount of people in a room.
Oh, okay, that makes sense. So with that being said, did you feel safe at work during the pandemic?
Yes. Mm-hmm.
Okay. Did you get to see COVID patients during your daily work life? And if so, how did you feel about that?
I did not. We're in a separate building, and they really tried to limit the amount of people. Only if you had to take care of the patient hands-on were you allowed into that area. They gave PPE. I know my sister, who's a nurse and had to take care of some COVID positive patients, they really sectioned off that area. So they tried to separate COVID positive patients from COVID negative patients. They're doing testing on every patient that had to come in. So, I mean, that would be a different question. You'd have to ask her how safe she felt. But at least for me in my department, we didn't have exposure and felt pretty safe.
Okay, so you said that that they were separated from negative and positive patients. Was that in like different buildings or like
in different buildings?
Oh.
No, and at my hospital, they did different buildings.
Wow, okay. So what was your average day like working during this pandemic?
So it was affected a little bit because since we're used to working with everyone in the same room or in a room down the hall, and you can go and have conversations, you can have ad hoc meetings. And then once we were in different shifts, I think it was a little harder. I shouldn't say harder. Everything was a little bit slower. So if my counterpart was working in the morning, and I'm working in the afternoon and I need something from her, I'd send her an email and I wasn't going to get it till the next day. So I would say it slowed down our workflow, our process a little bit. You have to make phone calls where before you could just walk over. But it wasn't, I think it was just kind of scary at first, because when they first locked down, I was working the second shift. I'd get out at 11 o'clock at night and was driving home and the streets were empty. And that was kind of crazy to see. I mean, you really don't see that. And you're the only car on the road, and we did have an official letter to say if the police stopped us, we would have the letter to say, I'm an essential worker. I just got off my shift. I'm on my way home. But it never happened. But it just kind of end of the world, it just kind of looks end of the world. There's just nobody out in the street. And everything was a little quieter, a little just scarier. I think, your team, we're a team of 30 and you have like 12 on your shift. And so you miss the other people. But it's okay. I mean, you do what needs to be done.
Wow. While you were working at the hospital, did any one of your coworkers fall ill with COVID-19?
So in my department, I was the first, which was kind of makes me feel like a zombie a little bit. There was a zombie apocalypse. We would have been eaten first, right? And actually, our exposure, it didn't happen at work. My exposure did not happen at work. It happened at home. When they released the lockdown, they started opening restaurants and bars. One of our family member went back to the bar, and there was actually a positive customer that had symptoms but had not been tested or was pending results. So the customer came in, wasn't wearing a mask because at a restaurant and a bar, of course, you're allowed to take it off to eat. So the customer had some symptoms, actually infected several of the waitresses in that area. It's all hearsay, but the story is that he also infected some of his coworkers from his workplace, came over to the bar, infected some of the waitresses. The waitress came over, infected my son, and of course my son and I do a lot of cooking together. So we were infected before we turned positive, of course, or we were exposed. So we were exposed. It took a couple of days. He let me know he had to test. His girlfriend and him had to test because they had the exposure at work. And so he called me and said, Mom, I'm positive. And he had no symptoms at the time. Says, Mom, I'm positive. I let my employer know, and I was sent home immediately because I had been exposed to someone who had turned positive.
Okay, wow. Do you know if your workplace has taken an economic hit during the pandemic, or are they doing very well, or maybe even profiting from this pandemic?
I don't think profiting. I think they're doing the best they can, but I think there's definitely a hit. All hospitals take a hit. A lot of the income comes from elective surgeries, and elective surgeries were not allowed in the beginning of the pandemic, and for some time they didn't start allowing them. So I think all hospitals across the country took a hit. I mean, it's definitely, you're taking care, you're using more resources to take care of the sick patients. You need more staff to take care of the increased sick patients. Everything, you need more oxygen, you need more, you buy the computers, you need more beds, you need more sheets, you need to wash more, you need more housekeeping to keep everything clean. So, I mean, I can't say, I don't know what I'm not in that department to know, how well it's doing, but I think you see all of our economy took a hit. So yeah, I do think my workplace took a hit.
Okay. And have your finances been stable during this pandemic? Please explain.
No, I think we haven't been affected to where we feel like we're losing our home or, we can't pay the bills. We've been able to continue to pay our bills on time, but definitely a hit with everyone else not working, and they're my sons. So kind of helping them out a little bit, or they're not able to pitch in, or they're not able, everybody's kind of staying home, not spending, not wanting to spend. You want to save what you have if you don't know what's coming up next. For a while, my husband was getting a lot of overtime because he was supplying all of the supermarkets with products. So he was getting some overtime there, and that was nice. But it really was just making up for the other family members not being able to contribute it. And really, the main thing was food. Food was difficult to. Once you have everyone at home all day long, now you don't just need to buy dinner, you need to buy breakfast, lunch, snacks, and then dinner. So the food was a big, probably what was most affected. And I think too, when we were off sick, we didn't go anywhere. We quarantined for the full 14 days. And the amount of food that's needed to maintain to feed 7 people, and we couldn't go out and buy it. We had to use 2 of my sons that the one that was negative, went to go stay with his girlfriend, and the one that doesn't live here, I had to give him a long list, and it's difficult to say, here, go buy $200 worth of groceries for a week to feed a family of 7. It's a lot of groceries. It's a lot of time. Not something they're used to, and not something they usually do alone. Like usually my husband and I go, it's a big effort to get all the food, bring it in, get it all in. So we had to do a lot of curbside ordering, and or they would come and leave it outside. We'd leave a table outside, or they'd leave it on the car, and then we had to go pick it up because we didn't want to expose them either. We wanted to keep them negative.
Okay, so this next group of questions will focus on your experiences at home with your family. They will also question about your experiences with COVID-19, with the COVID-19 virus, and caring for family who had it as well.
Okay.
So during the quarantine, in what ways did your everyday life change from normal?
When we were positive, is that what you're asking? Like, once we were all kind of sent home and tested, it took a while for us to turn positive. It was about 3 days before we started seeing symptoms, my husband and I. We did have one son that wasn't positive with everybody else, but he's our youngest son, so he's 16. We tried to keep him in his room, but it's very difficult to keep that one person negative if everyone else is positive. And then he wasn't in a condition, it's difficult to say, okay, 15-year-old or 16-year-old, go ahead and take care of the other 5 family members, that are sick. And so I think at first we were trying to quarantine everybody in their room and like only use this one restroom, and we're cleaning every day. But it was very difficult to have him take care of everyone. So instead of keeping everyone in their room and keeping the rest of the house clean, it just, this is going to be Hotel Corona. We're just going to be Hotel Corona. We're just positive. We're going to have to be able to be all over the house. So it was only a matter of time. We tried to keep him in his room and said, okay, we had that discussion of, is the COVID negative person going to cook for the whole family? And of course, he's 16, doesn't have the experience doing that. Or is the COVID positive person just going to cook for the whole family? And that's what we ended up doing, to be like, my husband, myself and Adam, my next oldest son, said, okay, we're positive, we're going to cook. We would cook with a mask. Everybody kind of stayed away. We really weren't hanging out with each other. And because we weren't sure how soon people were going to get better, and we weren't sure how long we were going to take to get better, whoever was sick. The concern, of course, was my husband and myself. We both have other conditions that we were worried would exacerbate the infection. But we made a decision to say, okay, I'm just going to cook for the whole family and try and take care of us as much as we can. And in the beginning, it's not so bad. I mean, you get the disease, I guess you catch it, and it's not so bad the first week. I know we were, I tried to ride my bike outside. Everybody was kind of staying away, but tried to ride my bike outside with a mask. And I'm like, oh, I feel okay. But that second week was a different story. After that, I didn't want to get up to cook for everybody. You're kind of just laying in bed, laying down hurts, sitting up feels a little bit better, very uncomfortable, very, a little more difficult to say, okay, I feel good enough to take care of everybody else. And you really don't. Everybody's just kind of moaning in their corner by themselves.
Wow. So could you explain the members of your family in your household, how many and their ages?
Sure. So the first exposure was Monica. She is my son's Adam's girlfriend, and she is 24. I should know, right? So Monica had it. Adam had it. He's 24. My next son, Alex, it did not have it, so he went to go stay with his girlfriend. He's 22. Then Abel is 20, and he had it. Avon is the 16-year-old. And then my husband, who's 46, and myself, who's 46. So we were in that kind of lucky group that weren't the high risk. Nobody's over 60. or 65, and everybody had a mild case. Everybody kind of had different symptoms. I never had a fever. I just really had a lot of headaches and a lot of body aches and pains. And everybody else kind of had the same. We all lost our sense of smell and taste. So food wasn't very appetizing. That was a weird time as well. And my husband would have a fever. I think he's the only one that really had a fever. Everybody else had cough, congestion, sore throat, headache, body aches. But we were all lucky enough to be mild, and none of us had to go to the doctor, and none of us had to be in the hospital.
That's good. So did any of your kids have to adapt to the new online learning environment? If so, how did their schooling change?
Yes, so I was going to school at the time, but mine was online, so it was fine. And my youngest, no one else is in school, but my youngest, a 16-year-old, had to go from after March, which was spring break. They broke for spring break and then never went back. So he had to go to school online, and it's difficult. I think it's not the same as being in class. Meetings are messy. I think it's harder to ask a question, harder to maybe stop the teacher when you have questions. And teaching yourself isn't the best way to. Not everybody learns by teaching themselves, right? Some people, whatever they are, they like to see it, they like to hear it, they like to do it. It makes it more difficult to be sitting to say, okay, now be responsible enough to watch your computer screen all day, listen to your teachers, and do all your work by yourself with no motivation, no kind of competitive, nobody kind of urging you on. I think that's probably been the hardest transition.
So
for him.
For him, do you know how long his day was? Like an estimation of how long the school board day was?
No, how long his school day was when he switched over? I think it was still maybe 6 hours, maybe 9 to 3.
Oh, okay.
Is what they started off with, I think, and last year, right? Or the last school year. And then this school year, I think it's about 9 to 4. So it's an hour longer.
Okay.
And doing better this time around than the first time. I know the teachers relaxed a lot of their standards, which was good in a way because it took them a while to transition. And right now, I think there's just a lot of work, a lot of assignments. I wish he was doing better, but I can see the kind of frustration with it as well.
So at this point, have you sent or are you going to send any of your kids to school?
No, I don't want to until I just don't think my workplace is a little bit more controlled. There's less people where everybody's adults. You can keep people separate. You can wash your hands. There's sanitizer everywhere. I think that's harder to control in a school environment. If I feel like I send them, I don't think they're going to social distance. I think it's hard to kind of keep a school as clean as you would like for it to be. If it was mandated, I would send them, of course. But as long as it's not, and until we have a vaccine, and I feel like it's a little controlled, I won't send them. And only to limit the risk that it's going to come back into our home, right? Since we didn't have control of the other people infecting a family member that comes home to bring it home. Like, I know my actions, but I can't control other people's actions. So I think that's where the anxiety is coming from. It's like, if I send them back, I don't know how clean the other students are going to be. I have this thought of like, they're positive and they're going to be spitting at each other or something. I mean, I just don't know. Kids just do crazy things. I don't think they social distance, and they're not wearing masks, and they definitely don't wash their hands. I think just the general population doesn't, wash their hands. So I'm a little germaphobe. So yeah, I think even though he's struggling with school in this format, I'm not ready to send him back because I don't think the schools are prepared.
Safety. So you said you got COVID, and do you know around what time of year you got that?
In June.
June. Okay.
Mhm.
So getting tested, how was it like getting tested? Could you walk us through that?
Yeah, so that was a little hard. In June, there really wasn't a lot of doctor's offices that were doing testing. We heard about one, I think it was Ashley Pediatrics, and they were charging $75 a test. And you had to go get in line very early because they would only do so many tests a day. So you had to wait in line. And this was when we were trying to get this testing, we only knew, I think it was just word of mouth. Social media was kind of posting where you can get testing. Because of the exposure to the customer, Monica and Adam went to go get testing at Ashley Pediatrics, paid $75 each. So when I had to get tested to see if I had it, my husband and I, we paid another $75 each because there wasn't any free testing anywhere. And they didn't take insurance because insurance weren't covering testing yet. So we paid 75 times 3, whatever that amount is, because we also tested our son. And then the rest of our family, we all wanted to know who's negative, who's positive, who's going to stay at home, who's going to, go stay somewhere else. So we all ended up paying $75 each to get the testing. And that's when we found out that Alex, strain 2 stayed negative, and that Anthony, who doesn't live here, but of course he spends a lot of time here with us, was negative as well. And so they both didn't come over. As soon as they found out they were negative, they went to go stay in other households.
Wow. Okay.
So that was, we spent a lot of money. Of course, we didn't get that reimbursed, but we needed to know so that we know what decisions to make for our household.
Wow. So once you got COVID, how did you avoid further spreading inside the household? I know you already touched on that a little bit.
Right, we didn't. We weren't able to census spreading. The only other negative one was Avon, but because we didn't have another place for him to stay, he stayed here. And it really was just a matter of time before we tried to keep him in his room. But of course, he has to come out. We're still using the same restroom. We're still using the same kitchen. It took him probably about a week and a half or 2 weeks before he got it from us, because we did try to keep him away. But it's almost impossible, right? You're in a house with 5 other positive people. How do you keep that other one? I don't know what else we could have done really to keep him negative.
Wow. So how did COVID-19 affect you while you had it? Like your symptoms from the 2 weeks?
Yeah, I've never had the flu. Only my children have had the flu, and I kind of see how miserable they are when they have the flu. So I can't compare to that, but I think at first I was a sore throat and a cough, then congestion and a headache, and the headache is constant. So you take Tylenol, it stops for 4 hours, and then you have to take Tylenol again so it can stop. Because if you're not taking the Tylenol, your headache, it just doesn't go away. I did not get a fever. There really wasn't much that you could take. So I was taking like Robitussin or something for cough, but it really wasn't stopping the cough. A lot of cough, my stomach, my chest was sore from all the coughing. Very tired. You're very tired. And I got this weird kind of sensation that nobody else got is you couldn't really touch me. It felt like a tingling, burning kind of feeling, my arms, my back. And so like my husband would try and rub my back, and he couldn't. I'd say, you can't, it hurts. It's kind of just not a good feeling. Nobody else got that though. We did lose our sense of taste and smell. And in the morning you wake up and you feel like, oh, okay, I feel better today. And around 7 o'clock at night, around, early evening, all of a sudden you just don't start feeling good again. And it's kind of like, oh no, I still have it. And they're tired, you're achy. I would lie down. I would just hurt to lie down on either side, your back. And I was doing a lot of sitting. I would sit in a recliner. I'd sit outside. I said vitamin D would help. So I'd go sit outside in the sun. But my mind was kind of spacey. Just a little. You're sitting out there and you feel horrible, and I just wasn't talking and you just don't have the energy to do anything. So But of course, no fever. So that kind of makes me think that all these temperature checks out there aren't really catching everybody. But, and everybody else kind of had the same. Losing the sense of taste and smell is the strangest thing. It's everything tastes weird and different. And we had cats, and that room where we kind of keep them was always smells. And I'd walk in there and I couldn't smell anything. And I'm like, I know this room smells, but I can't smell it. So that was kind of our test, right? Is the cat room. And to be like, I'm pretty sure, there's usually you can start smelling like, okay, this is smelling like you left the laundry in there too long, but we couldn't smell anything. And so that was really strange. And it took a long time to come back. And my son actually even still has, I had to read an article about it, is he has this persistent bad smell kind of stuck in his like memory or smell. And I guess his olfactory nerve or something's been damaged enough to where he still smells this one certain smell everywhere he goes. So he hasn't gotten over that, and we're already in November. So that's kind of strange. Wow. And I don't think of any other kind of strange. Everybody else is the same thing. Fever, congestion, cough is real bad. The achiness, the tired, everybody kind of had the same symptoms around here.
Okay, so yeah, that was the next question. That you guys all had similar symptoms?
We did. I want to say my husband probably had it a little bit worse. His cough lasted longer than everybody's. He did have fever. We did have to monitor his temperature. And but the cough congestion is probably the worst, and the taste and smell issue lasts a long time. Oh. And that really happens for everybody. That was the consistent symptom.
Okay. Was there a process you had in place to take care while you all had it, to take care of your family's needs while you were sick as well? What did that process look like?
I think normal. Everybody kind of does their own laundry and kind of feeds themselves. I mean, I do cook for breakfast and lunch. I do cook dinner. So that wasn't as hard. What we did is our oldest son bought us the meds, and we had them on the table. And it was just making sure we had enough Tylenol for everybody and enough Robitussin or Dayquil. I think Dayquil helped a little bit. By the time my doctors, I did have to check in with my doctor every week since I was out of work. I had to check in to see if I could be cleared enough to go back to work. And they really didn't have any recommendations for me either. There's a lot of like teas, do ginger lemon tea or do this kind of herb tea, and there wasn't any medications you can take for it to go away. You're just kind of maintaining symptoms, managing symptoms. And towards the very end, I think he said, you can take Zyrtec, but I was already getting cleared to go back. So we really didn't take all these vitamins that people were recommending, and you're just kind of taking Tylenol so you don't hurt enough until your body gets better, is what we did.
Okay. So did your insurance cover your any healthcare costs, or did you have to pay for any treatments, medical visits out of pocket?
Just the testing, the first round of testing we did when we were all positive, we had to pay for that. Nobody else was sick enough to go to the doctor. So nobody else went to the doctor, and I did, but my copay, my insurance pays for the visit, and I paid my copay because of that, because I had to get cleared to go back to work. Everybody else just needed a negative test to go back to work. They didn't need to get cleared by a doctor. And this next round of testing to prove that we were all negative was free, because at that point, the National Guard was doing those large batch testing at the Bert Ogden Arena. And so we all went through that to get our negative test to be able to be allowed to go back to work. Because at that point, everybody was home. It's mixed feelings, because it was kind of nice to have all the family at home. That doesn't happen anymore with adult children. So it was kind of nice, but of course, not nice because nobody else is getting paid. And then everybody's sick. But it was nice to have somewhere to be where we could all still be together and looking out for each other. And the good thing is that we all had mild symptoms or moderate symptoms.
So you did talk about this a little bit, but how would your family get groceries, food, and other home necessities while ill with COVID?
Mhm. So because we had our two sons that were negative and staying outside the home, we did some curbside, which actually took some planning because the spots would get tied up pretty quickly. So I would have to be planning over a week ahead and to do my order, and then I'd send my children to go and pick it up. Of course, you always need ad hoc orders to be like, we're out of bread or milk, and but it's difficult, I think, because of course they were still working. They have their own life, and trying to be like, hey, go buy all these groceries. I think that was probably the most difficult. And then trying to plan meals to where I don't have to cook for everybody because I felt sick. And it's like, there has to be food that you can, make yourself a sandwich or whatever. And it was hard to get bread out there sometimes it's hard to find bread. Sometimes it was hard to find Tylenol. Um, Definitely hard to find toilet paper and napkins. And so you don't want to hoard, and you don't have the money to hoard, of course, but then you have to be strategic in how you're getting the paper goods that you need for your family. So that was difficult, I think. And then the stores were closing earlier. 24-hour store was now closing at 8. And I guess this was while we were in quarantine, we had our sons to bring it. And I would have to take turns on which son I would ask, of course, because it's just a lot. And of course, they have their own things going on. But after we were quarantined, or I guess right before we got quarantined, the paper goods, trying to get enough toilet paper for this many was difficult. You either had to show up early or go consistently to the store until you're able to get something. And that, I think, was probably hard. Was hard for us.
So you said in the pre-interview that you had to work from home. So what did you do differently? Was it less or more work than usual?
No, it was the same. I think I did enjoy working from home. It's instead of waking up, an hour and a half before you have to go to work, you wake up 30 minutes before you have to log in. All the meetings, of course, are online. You miss out on the things that are happening real time. So now it's only what you're assigned. And normally you might hear a coworker and she has a question about whatever. You hear it and you can pitch in and you can say, oh, so-and-so is working on it, or here, I have this report, I can help you. So that is kind of gone. And it becomes where you're really just working solo on what you're working on. And you can't help your coworkers as much, or they can't help you as much. And but generally, I log off. The travel time, the time that you spend getting ready to go to and from work, the time you spend traveling to and from work, it's really nice because you get all that time back. You can wake up a little bit later. As soon as at one point I was working from home, but I was still a little bit sick. And so it would get to where, like, okay, I'm signing off of work, take 2 steps and then take a nap, because that was tough. But otherwise, it's the same. It's the same amount of work. The work is yours, you're assigned, but you miss the feedback of your coworkers.
Were any other members of your family forced to work from home, and how did their schedule change? So.
No, everybody else had to, because I have more like office style work. It translates well into working from home, but everybody else has a physical job and they just couldn't work. Nobody else could work from home.
Okay. So after they contracted COVID, did your family members continue receiving wages from work, or did they file for unemployment?
So my husband did have paid time off, and so he was continuing to get paid. But my other 2 sons, Monica and Adam, I think filed for unemployment, and they had a very difficult time. Every time they go in, you can't call in, the phone was busy, and every time you log in to the website, it was crashing, or it wasn't available, or you only had a certain time. So it took them quite a bit to get in there and apply for unemployment. And I think they only got maybe 1, maybe 2 paychecks, but because by the time they did get that money, they were able to go back to work. That's when they started. They were already negative, and they started opening up all the restaurants, and they went back.
Oh. So from COVID-19, how long did it take to recover? Like what the time period was, and was it a sudden Did you feel better, or was it more gradual process?
It was definitely more gradual. You kind of see that you're coughing less, you're not hurting as much. It took me 3 weeks, almost exactly 3 weeks, before I was able to get cleared. And the younger kids were probably within 2 weeks, they were fine. And so then it became this thing of my husband and I were sick for 3 weeks. Then and the other kids were already better. So we were trying to keep them. Then that's when we tried to separate and said, okay, you guys stay away. They started not eating my dinners. I was only cooking for the ones that were positive. And they were trying to stay away because they didn't want to, I mean, if they're negative, but they're hanging out with us where we're positive, and we didn't want them to take it back to their coworkers. So that's when we started separating more. But then within another week, we were probably a week or two behind them because they got sick before we did. So they got better before we did, but we took about 3 weeks, my husband about 4, but the kids were about less than 2 weeks. And then my youngest son actually only had a little bit of headache and the loss of sense of taste and smell, and he never had cough or congestion.
Okay. So after recovery, are you or any of your family members still experiencing long-term effects from COVID-19?
The shortness of breath lasts for a little bit after, but no, I think everybody's back to normal with the exception of Avon, who still has that weird bad smell kind of stuck in his senses. And so it's November, July. By July, we got sick late June, and we were all better by July. So July, August, September, October, November. It's been 4 months, and he still has. That's the only effect that I can see that he's, that my family's reporting. Everybody else, we're back to normal as much as we can tell, right? Maybe there's something going on in our cells that we don't know about, because studies are coming out now that there's some long-term effects, and but you don't know who has it and who doesn't.
So after you got COVID, did your family make any changes to your COVID-19 response?
I guess not really. We're still following what we were following before. We're not hanging out with our family members. We're not visiting. We're not having parties. And we used to have get-togethers a lot. My son, Avon, is playing football, but when we go watch him, there's only 2 allowed per child. They're social distancing. We're all still wearing masks. We all still have carry sanitizer in our car. But I mean, generally just following, the hygiene, the social distancing, and the mask wearing. We're still continuing to do the same thing.
Okay. So during this whole endeavor from the time that the virus got to the valley and now, did you do any long distance traveling during the pandemic?
No, we did not.
Okay. So this last set of questions will ask you about your perspective on the response of the local, state, and federal governments. So are you satisfied with the local response to COVID-19 in Hidalgo County, Edinburg, McAllen area?
Yes, I would generally say yes. I do think we opened too soon. I think we locked it down maybe a little too early. That's kind of hard to gauge, right? You can't really gauge. So we may have locked down too early and then we opened too soon. We really should have locked down when there was a time that the hospital was over. I mean, there's just all the new COVID units that were created were full. And that's when we should have been locked down. And once we opened, our family got sick after the first lockdown. The restaurants and bars opened up, and that's when the cluster came in. So I feel like we missed the mark. Were all the right things done? I think so. I think government has a limited way of kind of controlling people. I mean, they put out the mandates. You can lock down. Of course, you have to enforce. You have the masks. I don't know how much more they can do. People are so just innately disobedient, I feel. And like, how do you control the masses, right? So I think they do what they can. I think the PPE was a good thing. I think the paper shortage, I think, but that's really more on stores and not government, um, is not let people buy more than they need. I think right away, you know, in a pandemic, people are going to go get gasoline and toilet paper and napkins. I don't even know where that comes from. All the Lysol, you know, there's no more Lysol, there's no more cleaning, there's no sanitizer. A lot of the sanitizer they were selling wasn't at the percentage alcohol that you needed to be to kill coronavirus. And I guess I'm getting off track, but technically, I think they locked down too early and opened too early. But otherwise, I think the steps that they took were what they had with the information that they have at the time. They made the best decision they could.
Well, on a similar note, are you satisfied with the response from Governor Greg Abbott?
I guess I'm thinking of, I wish, generally speaking, testing had been more available to everyone. And I think the mandate, once you know that something's kind of working, like say masks, then require it. You know, be a little more aggressive. If you have the hindsight, maybe of not what's happening in your state, but what's happening in the world, and you look at other countries and what's working and what places and what's not working in the places, and then it's okay to kind of say, hey, let's copy what's working, right? And you know, the response just nationwide, and how every state had different regulations, I think that kind of hurts, right? Because it's hard to be, you're one state and you're saying, okay, we're locked down, but that other state's having parties, you know, and it makes it a little bit more harder to control the, you know, the masses. But I guess I don't have enough information to say yes or no. I think I'd have to go back and look at, you know, did we do it right? I think regardless of what people or the government saying, you have the responsibility individually to say, you know, what am I going to do about it? Or how am I going to protect myself? Or how am I going to risk other people getting sick? Sure. I guess I have no answer. I'll pass.
Okay. So, well, another one that's like that is, are you satisfied with the national response to COVID-19 by President Trump and his administration?
So there I can say probably I'm not, because when I started hearing some of the press releases where he's giving some of the misinformation, I mean, I consider myself a scientist, and I believe Dr. Fauci, you know, more with what he's saying, because they work in processes and workflows that I understand and I believe in, you know, when you're doing testing. When the president said oh yeah, we're just gonna inject, couldn't you just inject, or Clorox or whatever that was, I'm like, I'm disappointed. I'll say I'm disappointed. I'm disappointed in that he doesn't gather his facts before he speaks to the American public. And because at such a high level of power, people are everybody wants to believe you, wants to believe your leader, and your words are more powerful than you realize. And I think that misinformation where I've already set someone to be the lead of this task force and the lead of this pandemic, then you have to say, okay, you speak, I'll back up what you say. And he didn't do that, and I think that's what was disappointing, is the misinformation that was out there, and that he was supporting. So no, I think Trump could have done a better job, and politicians, I think, have a responsibility to give the most accurate information, because everybody's listening to you. I mean, not everybody's listening to Dr. Fauci, but everybody's listening to you. So you need to make sure that what you're saying is as factual as it gets. Like, these are the facts as I know them, this is what I'm going to report. And if you have to go back and say, oh, the facts were misrepresented, okay, I misrepresented. And I think if he would have had some of the states, I feel that he used that as part of like red states, blue states. I don't like that. I don't like the idea of this division in the country. I want it to be like, hey, we're all fighting coronavirus together, and not at against each other.
Right.
The masks, no mask, he should have supported wearing masks. If we know that it helps, then we need to do it. You know, even as they're not N95 masks that are preventing the spread of all particles, aerosol particles. But, you know, you do the best that you can. And I don't think he did that.
Okay. So if you had the power to respond to COVID, so what would you do differently, if anything?
That's a hard question. I think just our general public doesn't have all the information that politicians get. You have all these advisors, scientists and doctors and security people, and way more information. I don't think there's enough information. The general public just doesn't know. I mean, was this virus made in China, or if it was, it was fabricated in a lab? I don't think that was the case, but you just don't know. So I think without all the information that politicians get or that leaders get, it's hard for us. It's easy for us to be like, oh, that was wrong and that was wrong, which is what I just did, right? I just said like, hey, he acted inappropriately. But to make a call, for us to make the call without all the information, I think wouldn't be fair. It's easy to stand down here and say, you should have done this, but it is a hard call. But I think the protecting the economy with the stimulus package, I think was good. I think they should have had more. And this is just me generally speaking, right? I'm locking down where you see the virus traveling and locking down the areas where, like, if it's hitting me hard right now, we have to be on lockdown now, right? Like just kind of going with, I think we locked down too early. We locked down before it was happening here, right? But once it's happening here, lockdown now. And then I do like the push for a vaccine, but I think good science takes time, and I think the economy should be protected. I think there's people that are getting locked out of their, not locked out, but can't pay their mortgage, or they're getting thrown out of apartments. I think something should have been done there to give a little bit more safety. What are you going to do, with all these homeless people? And there's just so many things to consider. I think some of the people that are like, okay, you have creditors. I mean, a lot of bailout went out to these big companies, and a lot of bailout went out to the airlines. But then the people are kind of left to fend for themselves. I think that should have been a little bit more balanced.
Mm-hmm.
Or I'm recommending maybe, and I don't know what the rule is or what the law is to say, hey, we could have done this and everything would have been better. I think it's a complicated question. There's a complicated answer to it, but I still said a lot of words for something that I don't have an answer for.
That's great.
Mm-hmm.
Okay, so as you know, this is a special year in our national democracy because it's a presidential voting year. Well, first of all, did you vote? And
I did.
Okay, and if so, did you notice or do anything differently because of the pandemic, COVID-19 pandemic?
No, I didn't. I mean, generally, I early voted. And generally, early voting, there's not the lines that you see. It's one of those things that you should care about, people don't care about. So I didn't switch to mail-in ballots. I just went to a poll early enough that I knew people weren't going to be there. And I didn't. I mean, none of my family did. I mean, I think half of my family voted and half of them didn't. But they all went to early voting because we wanted to avoid the lines of, but I never do. I never vote on election day. I always early vote. So I really didn't change that this year.
Okay. So is there anything else you'd like to share with me about any experiences that you had with COVID-19 that maybe I didn't ask about?
No, I think I said a lot of words. No, I'm comfortable with what I shared.
Okay, thank you. Amazing interview. I think this concludes our meeting.
Sounds good. Good to
Bye.
hear from you. Bye-bye.
Bye.